Research into LDN expands, e.g. genomics, personalised dosing, novel delivery forms, etc. What areas are you most excited about for advancing treatment in general?
The anti-aging potential, anti-cancer. I think that the oncology world is really starting to twig to just how powerful this is, considering that we've got whole health systems devoted to just treating cancers, and they're now starting to pick it up and starting to deploy it in their patients. And as they get excited about it, this is where it's going to take off. So I don't know anyone who has not been affected by cancer, so to have another tool in the toolbox that is so positive for their health outcomes, you can build a whole world on that. So,
thank you, Sebastian.
I stick with PTSD and some of the mental health stuff. There's literally two studies on LDN as far as I know, and one of them is a case studies, Vipika Papa and Voller, and then combined with dopaminergic antidepressants, it potentiated it. So there's really, the field is totally wide open for mental health research, and there's nothing that touches PTSD like LDN does, or naltrexone for that matter.
Ditto? No. I would say definitely ditto. Well, I mean, we should have it pretty well established for pain now, but, you know, ditto on anti-aging and cancer for sure. I would say I'm also pretty excited about the potential for sports and optimization. I do a lot of that, and I see a lot of athletes, and, you know, they range from gym bro on some concoction that I have to call another gym bro to figure out what they are, to, you know, people who are athletes who are trying to refine and want peptides or whatever, but there's NADA rules and NCAA rules and Olympic rules and all these things. Whereas I believe, given the broad mechanistic actions of LDN, there's something there, either in the recovery or, if not, fully optimization. And I've been kind of playing with that, so I'm excited about that.
Keep us posted.
Anti-aging side of it, for sure, as I said, because that's a big area. But another area where I don't think it's going to happen, but I really, really wish it would become mainstream and actually come to fruition, is it should be compulsory for every teacher of young children to be on LDN and every parent of little kids to be on LDN. Think about the amount of absenteeism that you can decrease massively. I mean, wouldn't that be wonderful?
The use with pediatrics is really promising, but I don't think there's hardly any research other than the old stuff on naltrexone. But we don't want to mess with our kids unless, you know, they have to. And it's really hard to get a pediatrician to prescribe naltrexone, but that's wide open as far as the potential of this. Yeah, it's...
You want to comment?
Oh yeah, because
I mean, our peds.
I mean, you think about it, our children, like naltrexone, man, it helps adults.
So I don't know if I said this yesterday or anything, but it really warms my heart with that case in Florida where the pediatrician was very blown away by the impact that a patient of mine was placed on 6 different neurological based medications to control some of her severe symptoms. Turns out she had an underlying chronic infection. Thank God it wasn't Lyme disease, but where she responded so well to low-dose naltrexone, she's down to 2, including gaining off of her Cymbalta, that the pediatrician was so impressed that he said, I'm going to try this with other patients of mine. And now he is, I hope, actually I sent him the link for this conference. I hope he's, even participating now, but it opened up his world into a whole new way of treating his own children, in his practice. And to me, that warms my heart because, to answer the question on the future of low-dose naltrexone and what this looks like, I think that this is going to be a wonderful foundation of being able to build off of for a very wide range of practitioners we have worldwide, to be able to come together and say, by the way, it's working for this, how else can we help humanity? Because that's the point where we're at now, is really what it is. So I hope that answered.
Thank you, Dr. Werner.
Don't leave. So every year, University of Wisconsin, I want to say Madison, does an inflammatory brain disorder conference if you haven't seen it, and it heavily goes into pandas and spectrum disorder and things like that. And so, you know, that would be an area, right? Would you agree?
Absolutely.
That would be?
Absolutely.
Because we know it does it, but in kids, it's different.
And I think too, sorry. Yeah, I know, right? Another huge thing that we need to understand is that, you know, when we're talking about modulating the immune system, you know, a lot of what happens with this is also diet and lifestyle changes. So we need to really hone in on the gut-brain connection. So when we're talking about pandas, neurological disorders, GI, you know, all these different systems, they're all affected by what you put in your body. So while, yes, we have these wonderful tools, and low-dose naltrexone should be, you know, that huge, you know, first line, you know, that's so simple, it's also, you know, really educating the patient on you still have that responsibility. And, you know, when they start modulating and changing their lifestyle, you know, things go, you know, a lot of the systemic inflammatory things they're putting in their mouth, they're not doing that anymore. So that's where it's like there's so many things that overlap here, you know, that help. And, you know, so what was the question again? Sorry. So, the future direction. It's amazing just to open people's eyes and see that we're going to have true healing in every type of specialty, whatever you want to call it, because we're all coming together with a common understanding.
A common understanding, and I think that's a good place to close. I think that's been a fantastic guest appearance from Dr. Werner there. And I'd like to thank my expert panel for today and all our speakers throughout the week and for all the work that we've done. I think it's been an excellent day today and an excellent conference altogether. But specifically for the panel and speakers from today, if we can thank you, and then we can close conference. Thank you very much indeed, ladies and gentlemen.